for which this is their first webcast that they're watching with CUTR, and you just got a little taste of what it's like to listen to something that's being presented live. On behalf of myself and my dog, I apologize. We just moved into a new house, and we have a lot of people knocking on the door, and as a watchdog, he did his job, and now I have to do my job, which is to introduce today's presenters. And we see them here as Ranjit Gadavarthi and Jeremy Matson. Ranjit started working with the Upper Great Plains Transportation Institute's Small Urban and Rural Transit Center in December of 2012. He has research experience in the areas of transportation and highway safety, public transportation, low-volume road safety, roundabout studies, pedestrian studies, and freight transportation. Ranjit is from India, where public transportation is mostly used by people for commuting. Therefore, he believes in having an efficient public transportation network in rural and urban areas to maximize its benefits. During his graduate study, he had experience working with the ATA bus service, a paratransit provider in the city of Manhattan, Kansas, to determine the need for a fixed-route transit system. Ranjit received his PhD degree in transportation engineering from Kansas State University. He has received his BS degree in civil engineering from Nagarjuna University. Thank you, Ranjit. And his MS degree in transportation engineering from Kansas State University as well. Jeremy Matson is an associate research fellow, also working with the Small Urban and Rural Transit Center, started there in 2007. His research areas have included mobility and transportation needs of older adults and people with disabilities, mobility management, access to health care, rural and intercity transportation demand, alternative fuels, travel behavior, and impacts of higher fuel prices. He holds a bachelor's degree in economics and business management and an MS degree in agricultural economics, and is currently in the transportation and logistics PhD program at North Dakota State University. The learning objectives for today's presentation is that after this webcast, all participants will be able to understand the previous cost-benefit research for rural and small urban areas, develop a methodology for assessing benefits at the national, regional, and statewide levels, estimate the economic costs and benefits of rural and small urban transit, and identify and describe social, environmental, and other benefits. And with that introduction then, Ranjit, will you be going first, or Jeremy?
Jeremy will be going first.
Okay, well, it's my pleasure then to introduce both of you to our audience, and we look forward to your presentation.
All right, thank you. I'm going to start off by presenting the objectives of the research, talk about some previous studies that have been done, and the methodology that we used in this study, and then I'll hand it over to Ranjit, who will present the results from our research and the conclusions. So I think we all understand that transit provides a number of benefits within a community, and not just in urban areas, but in rural and small urban areas as well. But those benefits are often unmeasured or difficult to or unidentified, and some of these benefits may lend themselves easily to quantification while others do not. But decision makers need information both on costs and the benefits of transit operations to support their investment decisions. So the objectives of the research, like Joel had mentioned, it was first to review previous cost-benefit research done in rural and small urban areas, to develop a methodology for assessing the benefits at a nationwide level as well as regional and statewide levels. We estimate the economic costs and benefits of rural and small urban transit, and then also look at some of the social, environmental, and other less tangible benefits. So the scope of the research is small urban and rural transit agencies across the country. We define small urban as urban transit agencies, those receiving 5307 funding, but serving areas with a population under 200,000. And then the rural agencies are those receiving the 5311 funding. And we use data from the NTD and the rural NTD. Overall, there was close to 1,400 rural transit agencies and about 350 small urban agencies in the analysis. We looked at both fixed route bus and demand response service, and we tried to separate them where possible. And we present the results at a national level as well as regionally and statewide. So some of the previous research that's been done, going back to the 90s, a study by Skolnick and Schreiner, and they looked at a small urban area in Connecticut, and they found a benefit-cost ratio of 9.7 to 1, which is among the higher estimates that we found. Research by John Burkhart, he did national and local analyses of rural systems. He did a series of case studies across the country, and he found returns on investment of about 3 to 1, though he found that it varies somewhat. And research by Southworth et al. In Tennessee, they also found that these results can vary significantly depending on the type of service they provide or the people that they serve. But he found also that the benefit-cost ratios were greater than 1. Research by HLB Decision Economics in Wisconsin found a return on investment of 6 to 1. And more recently in South Dakota, HDR found that every dollar spent generated $1.90 in economic activity. So all these studies show that the results varied, but they all show that the benefits were greater than the costs. One of the main benefits of transit service is that it provides transportation to people who otherwise would not be able to make a trip, trips that would be foregone. And so I looked at some of the research on foregone trips and the cost of foregone trips by different trip types, including healthcare, work, and other trips. So for healthcare trips, a number of previous studies have shown that first, if you can drive, and then second, if you use transit, you make more healthcare trips. And there's certainly benefits associated with not missing a healthcare trip. A TCRP report by Hughes Cromwick et al. Did a cost-benefit analysis of providing non-emergency medical transportation they looked at 7 chronic conditions and 5 preventive conditions. So the benefit of providing this transportation is that if someone is not able to get transportation and they miss a medical trip, then their condition will not be as well managed, and then that can result in more costly care later on and reduced quality of life. So the benefit of providing this transportation is the difference between a well-managed and poorly managed care, which can include reduction in more costly care and improved quality of life. And they made some dollar estimates of what this improved quality of life would be in reduction in more costly care. And they found that the net health care benefits of increased access to medical transportation exceeded the additional cost of providing this transportation. And they also make the point that transportation really is relatively inexpensive compared to the overall cost of healthcare. So if a healthcare program is cost effective before considering transportation, it's still going to be cost effective after you take into consideration the cost of providing transportation. And some other studies have looked at if someone misses a medical trip, that may result in home health care costs or medical institutionalization costs, which could be avoided if they had access to transit. For work trips, we know many people rely on transit as a means to travel to work, so if they don't have access to transit, they can't maintain employment. And some studies have estimated the value of a lost work trip as the value of the lost wages. The research by HLB Decision Economics in Wisconsin, they estimated the benefit of providing work trips as the impact it would have on reducing public assistance spending. So if someone cannot maintain employment, they could be collecting public assistance spending, welfare. So they found that there would be a 12% increase in this public assistance spending in Wisconsin if transit did not exist. And in a similar study in South Dakota, HDR also estimated the increase in welfare recipients in the state of South Dakota if transit was not available. For other trips, some studies have looked at, for education trips, if someone is able to travel to school, they earn a degree, and then they'll make more money by having a degree. So they look at the differences in expected earnings. And for shopping trips, they look at the value of the trip as shopping expenditures that would be made. For some of these, estimating the value of some of these trips, I think prevents a lot of difficulties. It's a lot of assumptions. It's hard to know exactly how someone would respond, how someone would behave if they didn't have access to transit. If they missed a shopping trip, maybe they would shop online instead. So it's hard to really place a value on these trips. So we take a different approach in our study. The greatest value may be more qualitative in nature, in that you provide someone the opportunity to go where they want, when they want, and it improves their quality of life, which can be difficult to quantify. So before we developed the methodology, we first categorized the different transit benefits that we're going to look at. And we used three main different categories: transportation cost savings, low-cost mobility benefits, and economic impacts. And this is a similar categorization that HLB and HDR used in their research. So if someone who uses transit no longer has access to transit, they will either make those trips using some other mode, or they will not make those trips. So if they use some other mode, there's going to be costs incurred in using that other mode. And that's the transportation cost savings. These are costs that would have been incurred if a transit rider used a different mode in the absence of transit. If they're not able to make the trip is foregone, and there's the cost associated with that. And that's the low-cost mobility benefits. These are the benefits of trips made that would otherwise be foregone without transit. And then lastly, there's the economic impacts. This is economic activity resulting from the existence of transit operations. So transit agencies employ people, they give people jobs, they use resources, they benefit other industries in the area. And so these are the economic impacts that result from that. And there could be other transit benefits, but we didn't include it in our analysis either because it might not be as relevant for rural and small urban areas, such as land use impacts or congestion mitigation or some others, or they might be just too difficult to quantify. This is a more detailed categorization of the transit benefits. First, there's the three main benefits that I mentioned, and then the transportation cost savings is further divided into these different costs that would be incurred using other modes, either the vehicle ownership and operation expenses for people who drive themselves, chauffeuring costs for people who get a ride from someone else, taxi trip costs for people who use taxi. And then in addition to these out-of-pocket expenses, there's also other costs associated with transportation, including travel time, safety or crash costs, environmental or emissions costs. And so we attempt to include all these in our analysis. So the study methodology then is first to determine travel behavior in the absence of transit. What would someone do if they no longer had access to the transit? How many would drive themselves? How many would get a ride from someone else? How many would take a taxi? How many would just not make the trip? And then what's the trip, the purpose of their trips? A foregone medical trip, for example, is going to be worth a lot more than some other type of foregone trip. And then we calculate the costs incurred on the alternative modes, the value of the foregone trips by the different trip purposes. We look at the economic impacts of the operations, and then compare the calculated benefits with the cost of providing the transit to come up with some benefit to cost ratios. So first, the trip alternatives in the absence of transit. We relied on some previous surveys that have been done. This is from the Transit Performance Monitoring System, TPMS surveys that were done a few years ago. These surveys were done at surveys of riders done at different agencies across the country, and these were the results specific to the smaller urban areas. So we used this in our analysis for the fixed route bus systems. So for example, here we found it showed that about 21% would not make the trip, 23% would ride with someone else, 13% would drive themselves, 12% use a taxi. For demand response, we thought that the results might be a little bit different. So this is based on some current research that I'm actually working on. Here I did a series of surveys of demand response riders at different agencies across the country. And this is the results from that survey, which showed that about half of them would ride with someone else. Only 5% would drive themselves. Close to a third wouldn't make the trip. So these are the numbers that we use in our analysis for demand response systems. Regarding trip purpose, again, this is from the TPMS surveys. We use it for small urban systems. About 40% were for work, 19% of trips are for education, 5% for medical. For rural areas, we use these numbers. This was from the Rural Transit Factbook, which is a publication I put together, and the numbers are actually came from the 2009 National Household Travel Survey. So this showed that about 40% of the rural transit trips were for work, 7% for medical, and so on. And so we use these numbers in our analysis for the rural areas. So then the first category of benefits was the transportation cost savings. So then we attempt to estimate each of these different costs. So first, we know that some riders would choose to drive in the absence of transit. So we estimate the vehicle ownership and operation cost savings, or the cost for those who would drive if transit was not available. And here we use some AAA cost estimates, about 65 cents per mile. And we used that in our base case analysis, and then we did some other scenario that included higher costs. We know that some will get a ride from a family member or friend, and there's costs associated with that, chauffeuring costs. And here we used some research from Littman, which estimated this cost as being $1.05 per chauffeured mile. And this includes not just the vehicle operation cost, but also the time involved in someone making a trip that otherwise would not be made. We know that someone would take a taxi. So here we use an average taxi fare of $2.25 per mile, and this is also from Littman. We use a lot of the cost numbers in here we use from Littman's report. And then for travel time, crash costs, and environmental emissions, we looked at the differences between transit and the other modes and tried to put a dollar value on that. So for travel time savings, we looked at the travel time differences between transit and other modes and then assumed a value of travel time. For crash costs, we looked at the differences between crash costs and also the same for environmental emissions. And for these, we again used some cost data from Littman. And we expect that, we acknowledge that for travel time, there's not going to be savings for transit, and that the travel time is actually likely to be longer, to be greater. So that's an additional cost using transit that we include in our analysis. For crash costs, we expect the crash costs might be lower for transit, that there's probably some safety benefits to using transit. For emissions, it's harder to say. In larger urban areas, you expect some emissions benefits. In rural areas, might not necessarily be the case. So then the second category of benefits is the low-cost mobility benefits. And this is the benefits of providing new trips that would not be made if transit was not available. And then we looked at this by different trip types. First, for medical trips, the benefit of providing these trips is the cost difference between the well-managed and poorly managed care, plus improvements in quality of life, minus additional medical costs that would be incurred, divided by the number of trips required. So this is all from that TCRP report by Hughes Cromwig. They provided a spreadsheet tool which we use to come up with a value per trip of providing transportation to healthcare for people who otherwise would miss that trip. So for work trips, here we looked at the reduction in welfare and SNAP benefits that would result by giving people transportation to work. And then for other trips, we used a consumer surplus approach here, and this is similar to what HLB and HDR Decision Economics did in some of their previous research. And I'll explain that in the next figure. Consumer surplus is an economic term which refers to the difference between what someone is most willing to pay for something versus what they actually have to pay. And in this figure here, this downward sloping demand curve shows what people are willing to pay. It shows that as the price of travel decreases, people are willing to make more trips. So in this figure here, if there's no transit, let's say the price of transportation is P1. That could be the cost of using an automobile. It could be the taxi fare. And at this price, the number of trips made is Q1. And then the consumer surplus is this difference between what people are willing to pay and the actual price. This area here is benefit to consumers. Then let's say we introduce transit. Transit is less expensive, so the price decreases to P0, and the number of trips increases to Q0. So this difference here is new trips that are made. And then the consumer surplus increases to this larger area, and it increases by this area A and B. Area A is the reduction in price paid by travelers who were previously traveling. So they benefit from the lower price of travel, and that's the transportation cost savings. This area B is a benefit to people who previously were not traveling. This is the low-cost mobility benefits. And you can measure this as the difference between the two prices times the increase in the number of trips times 1/2. So we use this consumer surplus approach to estimating the value of providing new trips. And it's probably a conservative approach because it's hard to really know what this P1 actually is. For some people who can't drive, who don't have access to taxi, it could be really the alternatives available to them might be really expensive. So it's likely that this approach probably provides some conservative estimates. So then just to summarize the different unit costs that we use in our analysis, the vehicle ownership and operating costs. A lot of these other costs come from research by Littman, including the crash costs and emissions costs. And then for foregone trips, we estimated the cost of a foregone medical trip as being $357 one way, which really shows the value of providing medical trips to people who otherwise would not be able to get to their healthcare appointments. And then for work trips, we valued that at $49 per trip. And then the last category of benefits is the economic impacts. There's three types of benefits: the direct effects, the indirect effects, and the induced economic activity. The direct effects are the jobs created directly by the transit system, the people that they directly employ, the drivers, the dispatchers, the bookkeepers, and so on. And then the indirect effects, this is the jobs and income spent in industries that supply inputs or provide services to the transit agency. And then these people make money, they spend it in the local economy, and then that results in the induced economic activity. This is the economic activity resulting from income generated through both the direct and indirect effects. And to calculate these effects, we used a tool that was developed by Chu and published last year. This is actually research done at CUTR, and I learned about it from a webcast, from one of these CUTR webcasts from last year. And in his research, he uses a regional input-output modeling system, RIMS2 multipliers, which basically trace spending through the economy. And he notes that these economic impacts will vary based on the sources of the funds and the share of spending that occurs within the community. So if the funds are mostly outside the local area, if it's more federal funding, then the impacts in the community are going to be much greater, as opposed to if it was funded by local tax dollars, which could be spent on something else and have opportunity costs associated with them. And also, if more of the spending occurs within the local community, then obviously the benefits to that area are going to be greater. And usually most of the operating expenses are spent within the community, but with capital, it's not necessarily the case. for example, most vehicles that transit agencies purchase are not manufactured within the local area, so those dollars then go outside the community. So this tool is more intended for estimating benefits within the local area or region, and not necessarily for to estimate benefits nationally, which is what we were looking at in our study. So we just apply this tool to the state of North Dakota to show what some additional benefits that could be realized within a local area. So then I'm going to hand it over to Ranjit to show the results from our research, and then he's going to the benefits he's going to show are then based on the first two types of benefits, the transportation cost savings and then the low-cost mobility benefits. And he'll use that to estimate the benefit cost ratios. And then he'll also show results from that economic impact analysis for the state of North Dakota. So I'll let Ranjit take over from here.
Well, thanks, Jeremy. Hello, everyone. This is Ranjit Kodavarti, and I'll be presenting the results for the study today. Initially, I'll be showing the results of the total transit benefits, and then results of the costs, and then some results of benefit cost ratios, followed by some sensitivity analysis. First, getting into the transit benefits, as Jeremy was mentioning, when we say total transit benefits, we consider just the transportation cost savings and low-cost mobility benefits as total transit benefits for calculating the benefit cost ratio, because economic benefits were just calculated for the state of North Dakota. And getting into the rural transit benefits, a total of $1.6 billion were observed as total transit benefits in the year 2011. And among these benefits, more than 50% of the benefits were coming from fixed route bus service in rural areas, and the rest, 42%, which is $673 million, is coming from the demand response service. And if we see these, if we see the total transit benefits per trip in the rural areas, it was found as $14.56 per transit trip as a benefit. And if we observe the categorization based on the service, fixed route bus trip benefit per trip was observed as $13.50. However, the demand response trip has highest benefit per trip, which is $16.53. Well, this figure over here, this table over here shows the total transit benefit summary. I have different kinds of transportation cost savings specified here, and different kinds of low-cost mobility benefits, and the numbers are shown here for the fixed route bus and the demand response service. And it is initially, I want you to concentrate on the numbers that are highlighted in the red color. If you see for the demand response service, the travel time cost savings, the accident cost savings, and the emission cost savings was found as negative, which means that there are no travel time cost savings, accident cost savings, or emission cost savings for the demand response service in rural areas. And if you see the fixed route bus service system, there are no travel time cost savings and no emission cost savings observed. However, the rest of the transportation cost savings were found positive, which were observed existing. And if you see the total transit cost savings, which is the summary of the above, the percentage of the total transit benefits were low. The contribution of the transportation cost savings, which is 21% for the fixed route bus and 5% for the demand response service. On the other hand, if you see the total low-cost mobility benefits, they share a major portion of the total transit benefits, which is as much as 79% for the bus, for the fixed route bus, and 95% for the demand response service, proving that the low-cost mobility benefits share a major of the total transit benefits and are very crucial cost benefits. And also, these trips can be considered as very important trips contributing towards transit benefits for the rural transit area. If you get into the results of the small urban transit, A total of $3.7 billion was observed as transit benefits in the year 2011, and among that, most of the transit benefits was observed in the fixed route service, and the rest of the 6.6% was observed in the demand response service. And if we see the transit benefits for trip, it is observed as $10.43 as a transit benefit per small urban transit trip. And seeing the categorization of the service type, fixed route bus trip has a transit benefit per trip of 10.23, and demand response has a little high value of $14.31 per trip. If you see the numbers for the small urban transit, there are no travel time cost savings, accident cost savings, or emission cost savings again for the demand response service in small urban areas. However, there are no just travel time cost savings for the fixed route service. And again, the trend has to be observed here that the total low-cost mobility benefits share a major portion of the total transit benefits, and which proves that the low-cost mobility trips are very important, contributing towards the total transit benefits. Getting into the transit cost data, we have used the National Transit Database for coming up with the transit cost data, and looking at the summary of the operational expenses. Average rural transit operation expenses per trip was observed as $10.78, and the demand response operation expenses for the demand response trip was observed higher, which is $17.31, and it was for the fixed route trip it was observed a little less, which is $6.96. If we also include the capital costs along with the operation expenses, the average cost of a rural transit trip was observed a little higher, which is 10.71 when compared to 11.71 when compared to 10.78, just having when it is just operation expenses. And getting into the transit cost data of small urban transit, again the National Transit Database was used, and the average small urban transit trip operation expenses was observed as $4.49, which is a little cheaper than the rural case. However, the demand response trip costs higher, as much as $21.39 per trip, and the fixed route trip is again observed a little low, which is $3.63 per trip. Getting into the benefit cost analysis, I have a big table here, but nothing to be scared. I have the various kinds of transit benefits listed here, and then the transit costs listed here for small urban areas and rural areas. And I want you to look at the numbers that are highlighted in the red color, which are basically the summary of the transit benefits, and then the summary of the transit costs, and then the benefit cost ratios. And from this table, we have observed that the benefit cost ratio for small urban areas was observed as 2.16, which means that for every dollar invested, the output is observed as $2.16 for small urban areas. If you see for the rural areas, for every dollar invested, an output of $1.12 was observed. And this is based on the small urban area and rural area categorization. It would be nice to see the categorization based on the service type, fixed route service versus demand response service, and I have that in the next slide. The fixed route bus service has a little higher benefit cost ratio when compared to the average, which is 2.60 for the fixed route bus. However, the benefit cost ratio for the demand response service is observed as 0.64, lesser than 1. And it has to be noted that the main essence of providing the demand response service is not counting on transit benefits, but it is very useful for providing transportation options for the transportation disadvantaged. There are no, because of the data deficiency in the rural areas, we couldn't categorize the benefit cost ratios based on the service categorizations, but we have the service categorizations for the small urban transit. Here in the slide, I have the benefit cost ratios of transit in small urban areas and ranking of the various US states. and we can see all different states here, and if some state is missing, it means that we have some data lacking from the National Transit Database, and so we couldn't summarize the benefit cost ratio for that state here. And if we observe the table, we can see the benefit cost ratio for transit in small urban areas is as high as 4.96 for the state of Georgia, and most of the benefit cost ratios were in the range of 2 points and 1 points, and it went till 0.89 for the state of Alaska, and here we can see the various benefit cost ratios for various states, and this is for the small urban areas. If you see the results for the for the rural areas, the ranking of the US states are shown here. Again, the benefit cost ratio is as high as 4.19 for the state of Utah, and it went till 0.32 for Maine. Getting into the sensitivity analysis, we have used a lot of assumptions regarding the travel behavior and the unit cost from the previous studies while deriving the transit benefits, and it will be useful to understand the national transit benefits by using various unit costs and different travel behavior from various from others' perspective, and see how the values range from the base condition. And therefore, we have considered 6 scenarios for conducting the sensitivity analysis. Scenario 1 is we assume that the foregone trips are increased to 50%. What if like 50% of the trips were not made, because thinking that the foregone trips are very important trips and can contribute to better benefits. Scenario 2, walk or bicycle trips were decreased by half for the fixed hour service, because we observed them to be a little bit high. And scenario 3, we have increased the automobile cost from 0.65 to 0.84 dollars per mile. But we use 0.65. We have used 65 cents, assuming that a vehicle travels 15,000 miles per year, and according to the American Automobile Association report, 65 cents was the recommended value, but 84 cents was the recommended value if we use 10,000 miles per year for automobile, and therefore we have increased the automobile cost. Scenario 4, we have increased the cost of foregone medical trip and work trip by 25%, and we have decreased the cost by 25% in scenario 5. In scenario 6, we have the value of the travel time for transit and automobile are set equal. We have used different values in the base condition, and we want to see how the results change if we use the same travel time cost. Well, here are the results for the benefit for the sensitivity analysis. We have the transit benefits and the benefit cost ratio for the base case from the analysis, and for the scenario 1, which is increasing the foregone trips to 50%, we have observed that the total transit benefits were increased by 88%, and also the benefit cost ratio was increased to 3.17, having a significant impact on the benefits and also on the benefit cost ratio. And the next one I want to observe is scenario 4, which is increasing the cost of medical and work trips by 25%. And in this case, the total transit benefits were increased by 20%, and also there was impact on the benefit cost ratio of 2.02. And scenario 1 and scenario 4 has good impacts on the total transit benefits. If you see scenario 5, we have decreased the cost of medical and work trip by 25%, and the results would decrease, the benefits would decrease by -20. And apart from these scenarios, scenario 2, scenario 3, and scenario 6 didn't have a significant impact on the total transit benefits. Well, getting into the results of the economic impacts of spending on transit in the state of North Dakota, we have the impact values here. These values doesn't represent the national values, but are just applicable for the state of North Dakota. We have found out the for every $1 invested, how much is the output generated and how much is the value added, and what are the earnings. Initially, considering the unit gross impacts, for every $1 invested, we have found out that the output for every $1 invested was $1.35 and value added of $0.57 and earnings of $0.37. And for every $1 million invested, 10.3 jobs were supported, and the unit gross impacts does not consider the source of funding. And if we consider the source of funding, we have also used unit net impacts for two situations. The first situation is 25% of the operation expenses and 5% of the capital costs are coming from the local dollars. In this situation, the unit net impacts for every $1 invested, the output was found as $1.02, value added of 0.43 and $0.28 of earnings, and 7.8 jobs were supported for every $1 million invested in transit. In the next situation, if you consider 50% of the operation costs and 20% of the capital costs are coming from local dollars, for every $1 invested, the output was found as $0.69 and $0.29 of value added and $0.19 of earnings. 5.3 jobs supported for every $1 million invested. We're getting into the summary and conclusions. Only fixed route bus service and demand response service were considered for the benefits cost analysis in small urban and rural areas. And transportation cost savings and low cost mobility benefits are only the transit benefits that are considered in this analysis as total transit benefits while calculating the benefit cost ratio. And economic development benefits were analyzed only for the state of North Dakota. Demand response service in US was not found to have any travel time cost savings, crash cost savings, or emission cost savings, both in small urban and rural areas. However, if you see the fixed route service, there are no travel time cost savings in small urban and rural areas. Low-cost mobility benefits. Low-cost mobility benefits in this study were observed to be significantly high and have a major share in the total transit benefits, proving that they are crucial transit benefits, and also the low-cost mobility trips being very important for contributing the transit benefits. And more than 90% of the total transit benefits for the demand response service were contributed by low-cost mobility benefits. And if you see it for the fixed route service, more than 79% of the total transit benefits were contributed by the low-cost mobility benefits. If you see the summary of operational costs, average operational cost per rural transit trip was observed as $10.78, and if you see the average operational cost for small urban transit trip, it's just $4.49. Benefit cost ratios in this study are analyzed by just considering the first two categories of benefits and not the economic development benefits, and therefore the benefit cost ratios that were found out from the study can be underestimated and can be much more higher in the actual case. Well, that being said, the small urban transit has comparatively high benefit cost ratio, which is 2.16 when compared to the rural transit, which is 1.12. And small urban transit has proved that the fixed route bus has a benefit cost ratio of 2.60. There is no dollar there. The fixed route bus service has a benefit cost ratio of 2.60. However, the demand response service has a benefit cost ratio of 0.64, less than 1. However, demand response service is very important for the community in providing transit trips or the mobility for the disadvantaged. Getting into the sensitivity analysis, assuming 50% of the total trips would not be made when there is no transit, has increased the transit benefits by 88%, showing that the foregone trips has much impact on the total transit benefits. And increasing the cost of foregone medical trip and work trip by 25% has again increased the total transit benefits by 20%, showing much impact again. Well, with that, I think I'm through with my part of the presentation, and Jeremy and myself will be happy to answer any questions you have.
Okay, Jeremy and Ranjit, I wanted to thank you very much for your research and your very, very thorough and interesting presentation. And I wanted to take just a moment and ask Stephanie to advise all of those who are participating on the webinar how they can submit a question for you.
Okay. Thanks, Joel. Again, if you would like to ask the presenters a question, simply click that Q&A box in the upper left-hand corner of your screen. Type the question that you would like to ask, or if you have a comment. Click Ask, and then that question or comment will be read aloud by Joel.
Okay, great. And in the meantime, while people are putting their questions together, I had a couple of questions. And one of them is when we talk about the benefits of transit in small urban and rural areas, are those benefits, just for clarification, are they both public and private in nature, or are they all public benefits?
Well, some of them are private in nature, some are public. Like the transportation cost savings, those are savings to the individuals who would have to travel by some other means. Some of them are more public benefits, like the savings in say welfare spending or public assistance spending from providing work trips. Some of the benefits regarding, like, say, safety or environmental are more public benefits.
Okay, all right then, thank you. And in the beginning, you listed a number of studies that have been done, and in previous studies, the benefits have ranged from anywhere from the 2 to 1, or the ratio of benefits 2 to 1, all the way up to, I think it was 9 to 1. How would you explain briefly the reason for such wide disparity in such research results?
Well, some of the results are going to vary depending on the specifics of the agency being studied, because those that serve a higher percentage of transit-dependent riders, maybe provide more medical or work trips, they're going to show greater benefits, which is what our research also shows. And also differences in, I think, differences in the methodology and the ways that the benefits were estimated can produce different results. So we tried to be a little bit more conservative in some of our approaches.
Mm-hmm. Okay. Also, would you say that the methodology that you use as you looked at small, urban, and rural, would the same basic methodology be used for a larger urban area, or would you say something would be changed if that were done?
I think in the larger urban areas, we didn't consider some other benefits like parking cost savings or congestion cost savings, but the methodology is pretty much the same for the larger areas, but the unit costs might vary for the larger area, because when we are choosing the unit costs for finding out the benefits for small urban and rural areas, we make sure that the costs are applicable for the areas of our interest, but the methodology might be same, but the unit cost might be different. And also there are some other transit benefits that might be quantified and added for larger areas, like parking cost savings, land use impacts, congestion savings, and benefits like that.
Okay, great, thank you. Questions come in, as you noted in the poll that we took early in the webinar, that a lot of people who are listening today either serve or operate in small urban or rural areas. And the question is, how would you advise presenting the results to local elected officials that are not well versed in cost-benefit analyses?
I'm not sure if that's my area of expertise, but I think the results just clearly show that the benefits to users and to the community are greater than the costs of providing that service, especially if you're providing trips to to people who otherwise would not be able to travel. And you're providing medical trips, you're providing work trips that can impact public assistance spending or healthcare costs. Those types of trips have a really huge benefit on the individuals and also the community.
Mm-hmm. Okay. Another question is, when will your results be available in a report?
We have a draft report done right now, and it'll probably be a few months before it's going through review and some final editing, and I would expect probably this summer a final report would be published. And we'll have it available on our site, on our website, and I'm sure on CUTR's website.
Right.
It can be accessed from.
Okay. Yeah. Thank you, Jeremy. I didn't mention earlier on that North Dakota State University is a partner in the consortium of the National Center for Transit Research, and a great partner. We're really very, very happy to be working together through a University Transportation Center grant. And yeah, that'll be up on both of our websites hopefully by early summer. Another question is, were there any gaps in the data that, if those gaps didn't exist, would have helped the analysis?
Well, we found that when estimating the crash cost savings, the kind of data that is available for us for the small urban areas and the rural areas was different. For the rural areas, I think we had the total number of crashes available, but for the small urban areas, we don't have the crashes available, and so we have to use a crash cost per mile traveled. So there are some data deficiencies by which we have to use alternative modes to kind of estimate the transit benefits.
Mm-hmm. All right then. I think those are all the questions that have been submitted. So I would like to thank everyone again for listening and participating in the webinar. And before you go, if you could take just probably 2 minutes, we have a survey that we ask everyone who does participate to fill out in terms of whether the presentation met your expectations and whether or not it was the right length of time and if it was just right in terms of details that were provided. So with that, I'll be closing the webinar now, but thanking everyone again for participating and reminding everyone that, as Stephanie said earlier, every 2 weeks, every second and fourth Thursdays, we do offer these webinars, and the subjects are always on transportation, but they vary quite widely, and we invite you to listen again whenever you possibly can. These are also recorded, and if you're not able to see it on a live basis, you can go to our NCTR website and you can watch the presentations from our website at your convenience. So once again, thank you for joining us. Please fill out the survey, and we look forward to having you back again in the near future.
Thanks, Joel, and thanks everyone.
Thank you both.